is up, everyone? Welcome to another weekly live. I know that I typically go on live on Mondays, but now with the series that we're doing, looking at, check it out. I have a friend here. I was going to give her a very proper intro. Hey, what's up, Becky? How are you? Good to see you. Well, virtually at least. So yeah, we are continuing our series on the OT settings and talking about various other settings within the OT profession. And if you didn't catch it last week, we talked a little bit about being a CHT, and I interviewed Heather, and she talked about how she uses that to help musicians get back into playing. Today is going to be a little bit different. I just wanted to show you guys how you can basically have the same title as an occupational therapist, CHT, and still do things a little bit differently. So without further ado, I have an awesome friend of mine. Her name is Hoang Tran. Hi! So how are you doing today, Hoang?
I'm good. I think I need to scoot closer. Okay, yes.
Yeah, let's
I'm good. Welcome to Hands-On Therapy Services. I know you've been here before,
Yes.
but welcome back.
Yes, I actually love what she's doing here, and if you don't follow her on social media and know what she is all about, hey, Dr. Lambden, how are you? And Angie. Okay, so yeah, if you don't follow Hoang on social media, I suggest you do. She is at Hands-On Therapy Services and also at CHT Secrets, and she has a lot of great info on there. So, as I said, we were talking a little bit about how these are students that maybe not have yet to be exposed to what an outpatient ortho setting is kind of like. They may be deciding on what setting is right for them. Can you tell us a little bit about what you do as a CHT and how does someone become one?
Sure. Hi, and thank you for having me on your show. I feel like I don't know where to go. I'll just come closer to you.
Friends.
So in terms of occupational therapy, it's so diverse, and one of the areas that you can specialize in is to become a certified hand therapist. How do you become a certified hand therapist? Is that the next question?
Yes.
Okay, so how to become a certified hand therapist? Well, it actually takes, once you are an occupational therapist, then you have to want to specialize. So within the realm of occupational therapy, there's a lot of different routes that you can do. So usually when I get volunteers that come in and ask me about different things about occupational therapy, I sort of use an analogy of becoming a chef, right? So if you cook and you become a chef, then you can learn to cook different things. And you can start to specialize, like let's say you want to specialize in cooking a certain type of food, like Asian food or Italian food or that kind of stuff. Those are different specializations, and occupational therapy has that too. And if you were a chef and you were like, oh, I wanted to, really become like super specialized and become like a pastry chef, then that's like very similar to being an occupational therapist and saying, I want to really be specialized and become a certified hand therapist. So a certified hand therapist helps people with different types of hand, wrist, elbow, shoulder surgeries, and even neck surgery, neck problems, because a lot of neck stuff goes into the hand. Not all certified hand therapists work with all those areas because, again, you can really, really specialize as well. You can become a certified hand therapist once you once you've graduated from occupational therapy school and decided, yes, I want to become a hand therapist. I need at least 4,000 hours of working with anyone with an arm and hand problem. And then you have to have at least 3 years of work experience as an occupational therapist, and then you have to pass a pretty rigorous exam, and then you will become a certified hand therapist. Now, it's not just because you get 3 more letters behind your name, but some people like to do that. It requires a lot. It's for somebody who want to keep learning and studying, because when you become a certified hand therapist, you have to actually take more continuing education classes. So not only will you have your license as an occupational therapist, but now you have a license as a certified hand therapist, and you're required to continue to upkeep your education, which is one of the things I really love about it, because it's really for somebody who wants to keep learning and wants to keep in a way like elevating like what they know and how they practice.
Okay, so you said that you had to go through, jump through all these hoops, and continuously considering that you have to maintain that separate licensure or certification, really. And so what made you then decide to become a CHT?
Well, I was working in a burn unit, and then I was also volunteering. I was volunteering in a hand therapy clinic, and I just really loved what they did. And then through my experience of different internships, I was able to work with certified hand therapists, and I just really liked how certified hand therapists, it's very, very technical. So I think it's great when a therapist can be a lot more holistic. So I don't always think like, oh, you should, well, because we're talking to people who are looking to get into occupational therapy school, right? So I actually had somebody who was like, oh my God, I want to get into occupational therapy. I want to do hand therapy, and I want to work very specifically with hand therapy in this niche. I think that therapists do much better if they're a lot more open-minded, experience different things, because then when you go to niche down, to specialize, you have a lot more experience and a lot more, in a way, like consideration for different hand and arm injuries. I don't know if that makes sense, but I did everything before. Maybe that's why I say that, but I worked in nursing home, I did skilled nursing facility, rehab centers, I did acute care. I actually love acute care, but every area has like a who it's for type of thing. Like you gotta like certain things about it, and like I just loved acute care.
You know, and I'm glad that you're mentioning all this, because I'm not gonna lie, and you know me already for a little bit, for some time, and you know, for a little bit of tidbit or information, I actually have applied to work with Hoang, and anyway, but the thing is, I've applied to work with her, and just by continuing this rapport with her, I've learned so much.
She's trying to still get a job. I see it. It's okay.
No, okay, so she was actually in an interview with Seniors Flourish, and I listened to it, and
shout out to Seniors Flourish. Yes, Mandy, she does a great membership site, and she's got great information throughout social media. So if you don't know her, definitely subscribe to her podcast and listen to her. She's got a lot of great things to say.
So long story short, I was listening to her interview with Mandy, and something so simple yet so profound. You know, I don't remember verbatim what question Mandy asked, but Hoang said, you know, well, if they have two hands and they have two arms, you can work on them. And I was one of those, as an OT student, as a pre-OT, like, no, well, I need to be in an outpatient ortho center. I need to be in an outpatient ortho center. And I need to, you know, like, and I was so like fixated on like, that's why I need to work with Hoang, because she's going to like take me to the next level. And I'm like, listen, and then hearing that, I mean, but hearing basically, you know, that as long as people have two hands and two arms that you can work on,
you can always help them.
You can always help them, and you can still always learn from new diagnoses and improve your clinical skills on your own. You know, like, it was honestly very liberating. You know, like, you know, I didn't feel like, oh my gosh, now I'm never going to become a CHT or something like that. You know, so that was really awesome to just kind of hear. And so for any of you that just basically feel that outpatient is like the only way, like, and like You can
It's not.
learn.
It's not.
Yeah.
The great thing about being an occupational therapist is that there's a lot of areas in which you can focus on. I would say, as somebody who is looking to get into the world of occupational therapy, to apply for occupational therapy school, is that you stay open-minded and be open-minded. I'm going to tell you a funny story. So I was applying to occupational therapy school many, many moons ago, and they invited me in for an interview. And at that point, I was like, oh, I want to be a certified hand therapist, because I volunteered in pediatrics in a hospital setting, and I decided that working with kids after working in a school for 2 years, that maybe pediatrics wasn't something that I'm naturally inclined to be good at. So I also volunteered at a hand clinic, and I just found it really fascinating, even though sometimes when you're a volunteer, like, you do nothing sometimes and it's tiring. So sometimes I'd be like falling asleep, like getting, waiting for them to ask me to get a hot pack or a cold pack. But I did find it very interesting, and there's a creative side and a technical side to it that I really enjoyed. And so all the certified hand therapists that were in that setting, in that clinic, they were all occupational therapists. So I thought all occupational therapists were certified hand therapists, and that was a big no, wrong. Mm-hmm. So I go to this interview, and I guess I wrote into my my essay or my story or something like, I want to be, no, I think it was in the interview. And they're like, well, why do you want to be an occupational therapist? And I was like, well, I want to be a certified hand therapist. That's why I want to be an occupational therapist. And the woman looked at me and she's like, well, did you know that you could be an occupational therapist or a physical therapist and be a certified hand therapist?
Ooh.
Yeah, that was me. What? And I was like, oh my God, no, I'm never. So anyway, I didn't get into that school, but I did get accepted into a couple of different schools that I could pick from. So that was definitely a learning lesson, that in terms of specialties, you don't have to pick it. You can have maybe like a general preference, like this is what I would like to do, or maybe this is why I'm geared towards. So sometimes people come and volunteer with me, and let's be honest, they just volunteer with me here because it's an easy site to get. You don't have to do like a ton of hours. I mean, I do have strict requirements and stuff like that, but it's not like a ton. You're not giving your arm to come volunteer here. So some people already know, like, I really love working with kids. I want to work with kids. And I always encourage people, like, yes, have a preference, like working with kids, working with adults, working in mental health, working with older adults, anything like that. Like, have a preference. But if you are looking to get into occupational therapy school, like, I think it's important to keep an open mind, and there's a lot of opportunities if you keep an open mind to say, like, oh, okay, this is what I like, because you might actually like working in other areas. Like, I loved working in acute care, because in acute care you actually work with a lot of people with different arm and hand injuries. They're just a lot more severe sometimes. Right. And it doesn't mean that you have to be in an outpatient setting. A lot of people think in the outpatient setting because maybe you get to see certain types of surgeries or certain types of injuries and stuff like that, but all of the outpatient settings can be really different, and the population of people that you serve can also be different depending on where you live, where you work, and who that business promotes to.
I'm glad that you mentioned about having an open mind, because even especially for UPOTs that are watching, schools, when they are looking to see who they accept as a candidate, that is a great quality that they are looking for, and it's a common interview question that they even ask during interview time, like, oh, do you have a setting that you're interested in? And they are also looking to see how open you are, because that's also going to create work for them if you're the type of student that, no, like, you're fixated on whatever setting, and now you're probably, what that means to them as a university is that you're going to be on your fieldwork coordinator's case, like, I want this place, I want this place, I want this place, and it just, they may not want to deal with that, and they may not look at that completely favorably, shall we say? Like, you know what I mean? So if during interview time, I think it's great that if you have a preference and share that preference, but as she said, share that you have an open mind and genuinely have that open mind, because you really may just end up liking something else so much more. I thought I originally wanted to do peds, and I found out that I did not. So
I think that peds is a great area.
Yeah.
And it takes a certain, I feel like
it takes a certain type of person. Yeah, it does. And so, which leads me to my next question. What type of personality or what type of person does it take to be an outpatient ortho?
Was that one of your questions? I'm not really sure that's one of your questions.
Like,
what does it take?
Yeah, or like what type of person do you think, like,
outpatient ortho is very technical compared to, let's say, skilled nursing, but in a technical way of like very specific body parts and stuff like that. Certain things can be very technical, depending on diagnosis in different areas too. Like I would say peds, I think that you do a disservice to the clients that you serve, the patients that you serve, when you don't like a certain area. So for peds, there's so much to do in pediatrics, but you just have to love it, right? You have to love it in order to spend more time and spend more of your resources, which means money, right? So when you come out of school, you want to keep continuing your education and learning the technical side of being a therapist. When you're in occupational therapy school, you're learning the basics. You're learning how to do certain things, but the basics of it. And then when you go into the work realm and you start to work in certain areas, you find that, I kind of like peds, or I kind of like hands. Then you're going to start to take some of that time and resources that you have to take classes, continuing education classes, stuff like that, to know more and learn more and improve your skills, right? So in outpatient hands, it's a lot of studying. I mean, a lot of students come out of school and they're like, I'm out of school now, I don't have to keep studying, like I'm done. Like, I get that, but it's very important that whatever position you're in or whatever setting you're in, start to learn more about that setting, or save some of that money that you're making to spend to learn to get into an area that you want to get into. So I can only use my example. I came out and had per diem jobs like all over the place, hospital setting, skilled nursing, all that stuff. And I was, back then there was a lot more quote unquote training, but not a ton. Even then it was starting to get less and less. And so I had to rely on doing continuing education classes to learn more about what I needed to do. So I was doing a lot of wound care, took a wound care class so I could be more confident, I can improve my skills. And then I took, every year I took one or two classes. You gotta pick your classes correctly. You gotta, those things are important. But when you're pre OT and you're trying to get into school, I don't think you have to fixate on a specialty or what you might be good at. I think that you want to pick your brain and make sure that occupational therapy is what you want to do.
100%.
And I would tell you that if you are an occupational therapist and you've got into school and now you're going through it and maybe you get out, and I've told my staff, I've told new therapists that come to me for advice, it takes a good 2 to 3 years, sometimes a little bit more, to kind of like fall in love with your profession.
I would agree.
Yeah,
I would agree, and just even feel confident in what you're doing.
It takes a while, because you can't really love it if you don't know it, right? So once you get through the school, it takes a little bit of time to fall in love with the profession. So as a pre-OT graduate, like, definitely get out there, learn about different OTs, There's so much more available on social media and stuff like that. Look at what people are doing. Go in and volunteer at several different places. Just don't look at the easy stuff. I highly recommend going to a hospital setting, volunteer in a hospital setting, go into peds, volunteer in peds, go into hands, volunteer in hands.
Yes.
You know, if you can do like several different places. I know like some people work and they can't do the hospital settings because you have to volunteer a lot of your time and you have to do orientation and all that stuff, but it's really important. You're going to spend a lot of time and a lot of money getting an advanced degree. I think that the most important thing that you could do is to make sure that you want to be an occupational therapist, because it is a great field, but you have to want to be an OT to make it great.
For sure. I couldn't agree more. And I know I've said this to you guys before in previous videos. If you're not sure as to why you're even picking OT and you're just kind of doing it because, oh, well, it shows on Forbes that it's going to be in demand and it seems like something that I guess then you're likely to burn out, you know. And
well, yeah, maybe, but I think it's important when you're looking at a career to look at the job availability and the like, you don't want to go and get a degree where you can't come out and get a job. You can come out and get a job as an occupational therapist. Maybe not in every big city. Miami is actually quite difficult. But if you're willing to move, I mean, there are a lot of jobs. If you're willing to work in different environments and different settings, you can find places to work, I think.
For sure.
I haven't looked in a while, but
yeah, someone over here became a business owner 5 years ago.
5 years ago, I decided to open my own business.
And we'll talk a little bit about that in just a second. But before we do move on, Nikki Elizabeth wants to know, where did you go to school again? I don't know if she's talking to me or both, but I went to Florida International University. And
I went to University of Florida. Go Gators.
Roar. So yeah, that was to answer your question. But
sorry. So when it comes to schools, you want to, and I have a lot of people who come through my office. Actually, my assistant just got into occupational therapy school, so we're very excited for her. And yeah, I've had different students come through, and they actually I've had volunteers. Actually, one of my staff therapists, she volunteered with me moons ago, and then she went through school. She went to Boston University and came out and has been working in Miami and just started working with us here recently. So
that is awesome.
When it comes to schools, I have a lot to say about schools. Do you have time for this? No, I'm kidding.
Just say what you got to say. The platform is yours.
Listen. When it comes to school, you do want to find the right program that fits like what you want, what you need. I actually am an adjunct professor at Barry University, and they have a great program. There's a lot of great programs here. You want to make sure that your program is accredited, one. You want to make sure, like, for some people, they need the weekend programs, and for some people, they do the full-time weekend, for the full-time during the week and stuff like that. I find that those are, ideal. Even though I teach at Barry University, I hope they don't kill me. But it's good because you form a lot more connections, it seems, when you go to a full-time program versus it's a full-time program but on the weekend. So on the weekend, people are flying in and stuff like that. So they stay for a short period of time. And then they have to go and leave and live their respective lives. So I feel like sometimes a little bit harder to make that connection if you're not there full time. But outside of that, regardless, they're both fine. You want to be with a school that has, if you do have a kind of affinity towards certain settings. You want to pick a program that has connections that will help you with that, right?
Yeah.
So you want to make sure that they have good internships available for you, because internships inside that program is everything.
Yeah, I would say that the first year or two of your career is pretty much gonna start you off and like kind of almost like not determine your path, because you could technically always change, but
you can change all the time.
Yeah,
change all the time.
You can change all the time.
It might take a lot more. It might take effort.
Exactly.
It might take effort, but you can change anytime you want.
Based on other therapists that I have met or talked to, it seems like whatever setting they end up in from their first couple years is where they just end up staying.
That's not true.
No.
Who are you talking to? Who are you talking to?
A lot of pediatric therapists that they've just been practicing for like 25 years.
But they want to stay in pediatrics. No. Otherwise, like, why would you stay?
They love it. I'm not saying that they don't.
Yeah.
I'm not saying that they don't.
We won't call anybody out.
Like, how have you been practicing outpatient ortho? Like, you know, it just kind of seems that people just overall, that once they find their niche and what they love, which is why I'm also doing this series, because I want you guys to get an idea of what it's like in various type of settings, and the type of settings that are available to you as an occupational therapist. And so, yeah.
For a year, I did nursing home, skilled nursing facility, rehab, and then I went into the hospital setting. Well, so even as my first year, I did hospital stuff. But I took a full-time job in acute care, working at a hospital in acute care, and then I would also cover like rehab if they ever needed it. And I really liked it. I just like working with adults. In acute care, I had an opportunity to work with NICU babies. So I took a course, got trained and all that good stuff, worked with NICU babies. Cool. And then I also did developmental clinic, which is like you follow those NICU babies for 2 years. So I was really good at doing evaluations to kids. And I wasn't good at like doing the therapy, but I was good at like saying like, something's wrong with you. Something's wrong with your baby. You need therapy. And then I could give like a few tips, like a few exercises and stuff like that. But like that's what you do as a therapist. You evaluate. It's like constant evaluation. Like, okay, I see the developmental timeline. So I mean, imagine I'm working with adults. I'm working with geriatrics. I'm working with strokes, ortho, like everything. You got to know everything. And I knew then, while I was working in the hospital, that I wanted to pursue to become a certified hand therapist, because I was doing a lot of different hand stuff. I was doing a lot of orthosis, fabrications, stuff like that, wound care. So I knew it. I just didn't have the opportunity to go and work in that typical outpatient, setting that everyone thinks that they need to have. And so I created my own opportunity, which was in acute care.
I think you did as an occupational therapist, where you take your career is totally up to you.
And so much of it is about patience, right?
Yeah.
So much of it is about patience. And I tell people about patience and they never have patience. I mean, I'm guilty. I don't have patience for everything. Like, I want everything now. I want my business to grow faster. I want to provide more stuff on CHT Secrets. Like, I'm one person. I cannot do it all.
Right.
And so the impatience it's your driver, right? It's your driver, but don't lose sight of, trying to kind of like back off the pedal a little bit to give yourself a break. So I had a great position, I had a great job, and then everyone there knew that I had an interest, and I was doing things to show that I had interest. Like, you don't just say you have an interest, you show that you have an interest. So I said I was interested in this, and I took the classes to show that I was interested, that I was improving my skills. Like, I wasn't waiting on somebody to be like, this person's going to show me what to do. Nobody will just do that for you. You know what I mean? It's very difficult to have that, even back then, and it's even more difficult now, which is one of the reasons why I created CHT Secrets. And what I in my mind envision it to be, to become. But patience was one of them. But everyone in that environment knew my interests and knew what I was doing to work towards it. And when the opportunity came up, I was the first person they called. And so then I moved into outpatient, and I'll tell you, I got the job not because, I was so much better than so-and-so or whatever. I got the job because I was like, listen, I'm going to take this job. I'm going to pass the certified hand therapy exam, and I got it. And then I was shitting bullets. Like, oh my God, like, I got all this stress. Like, it's a 50% pass rate. It's no joke.
No, it's a hard exam from what I hear.
Like, it's a hard exam.
It's a very hard exam.
I mean, the COO of the hospital will come, hey, how's that setting going? I'm like, oh my God, she knows that I'm taking it. Like, holy shit, what if I fail?
Yeah, oh my gosh.
Yeah, no, I was very stressed. The doctors were calling me like, hey,
I was like,
let me know when you pass. I'm like, oh. But you know what? It lit a fire under my ass, and I freaking passed it.
This girl's a firecracker. She has even written a book. Okay, and do we have the book here? We didn't get the book.
I have a book. Do you want me to go get the book? I have mugs. People first. Cheers.
Cheers. Hands-on therapy services. Go follow. So
oh my gosh. Yeah. Go follow CHT Secrets.
And CHT Secrets. So yeah, she wrote a book, and it is actually the next book on my reading list. I was telling her that I tend to read a book a month is what my personal goal is, and it is going to be my April book. So I am looking forward to basically reading it. I got it when we were celebrating her 5-year anniversary party here as she opened hands-on therapy services, and from the looks of it, I was kind of just going through some of the chapters, skimming of it. It definitely seems something that is going to be a good read, especially the chapter that says why occupational therapy. Like that, it was one of the chapters that got to me. That's her. Aww. It's on Amazon.
Yes,
I'll be posting the link if you guys want to buy it.
Yeah, you can order it on Amazon. It's
hands-on approach.
Yeah.
Hands-on approach. Bye.
It's just a perspective of helping people avoid surgery and live more actively without having to take pills and get injections and
So this is a book a little bit that explains about some of the patient that I guess you have seen. Can you tell us a little bit about the book?
Sure. It's a book to help people understand and know that they don't have to live so painful. One of the things that I started to notice quite a bit was when I opened my own practice, it was apparent that people live with a lot of pain for a very long time. I mean, I've met people like 20 years, 25 years. They just live with constant pain. And they just don't know what to do about the pain. I mean, yes, we have a lot of information on YouTube, on Google and stuff like that, but sometimes when we have too much information, sometimes it could become very unclear about what can happen. And if you've gone to therapy somewhere or you've gone to doctors and stuff like that and you've kind of not gotten the results that you hoped for, it can be really discouraging. And it could be like, oh, okay, so now I have to just live with it. Or maybe they've been told that they should just live with it. And I have found that they don't. If they are helped in a certain way to get clarity in terms of what they need to do or how they can go about getting the right kind of help, then they can live with less pain to no pain, and they can avoid things like having to take pills all the time, get injections. And so I decided to put it all in the book. And so it's very much speaking to the people who are living in pain and looking for an alternative. It's not a book necessarily by a therapist for a therapist. Like, I'm not necessarily teaching technical things like
Right.
the rotator cuff or these four muscles, but I do teach people that it's possible when you have a shoulder injury and your shoulder hurts, that if you get the right kind of help, you can get rid of it. When do you know, kind of like, when do you know you need to go get help? Sometimes people, they have pain. They just, as long as they're able to do their everyday life, our body
just dismiss it. Oh, go away.
They go to sleep every day and then wake up every morning hoping and praying that their pain went away. I had this conversation the other day with a young gentleman who had wrist pain, and he had wrist pain for 3 years, and it just escalated and escalated. And finally, he said, I just couldn't open a bottle of water, and that's when I realized I need to get help. It had been 3 years that he had been suffering, but nobody wanted to give him an injection. He wasn't a candidate for surgery. He had tried therapy before, and it didn't really help him. So he figured, he was getting old. He wasn't that old. And that was just the way it was.
Okay, so last week, we talked. I spoke with Heather Wilkins, who also is a CHT, and she helps people get back into playing music. This young man, he was coming to you for help. Like, how could you, I guess, what type of help do you offer as an occupational therapist to him, and how would it, what could you do for him?
I was very clear in terms of how I could help him. That's what I did for him. I mean, outside of any technical stuff, we give people clarity. We help them understand.
Clarity.
We help them understand. My goal isn't focused towards musicians like Heather and I.
Right.
Love Heather. Her and I met online, and then, we stay in contact all the time. But, I've helped.
The OT world is small, guys.
The OT worlds are really small. Do you know how I know Jessica? It's because her best friend volunteered with me before she got into occupational therapy school. Yep. And then she got into occupational therapy school, and then now is working as an occupational therapist. Ta-da! It's very small.
So,
don't burn bridges.
That was just a little,
don't be
bridges.
mean.
Don't burn
Be
bridges.
nice to me. No, I'm kidding.
Yeah, but she's easy to be nice, and she's cool.
I let her drink wine. That's why she's saying all this nice stuff. We're hiding wine in here.
Shh. All right. Anyway. All right. So, so the population that you are helping is people that are having some sort of physical injury. And what is typically like your goal with these patients? Is to get them to be I don't know, like
the thing with I serve two patient populations here. I serve the people who have an injury so bad that they had to have surgery, right? So then now they have so much pain, they can't move, they have wound care needs. Like, basically, they can't wipe their ass, right? Let's just put it like that. They can't wipe their ass. They're like, please help me now. I help those people. No, those people can't do anything. They can't. They're dreaming about opening a water bottle. They're just dreaming about brushing their teeth and eating with their dominant hand. So I help those people, and they're, in a way, they're easier to help, right? So I think that's what draws sometimes people to hand therapy, because it's like, it seems so cool, like, oh my God, someone broke their hand, cut a tendon, but shit, that had to happen to someone for you to treat them, right? So that's my perspective. So those people, they have severe injuries and they need your help right now. The other people that I help can do everything. They can wipe their ass, they can eat, they can do everything. They get dressed, they can go to work, they can drive. The problem is their quality of life is diminished. And that's who I help with my book.
There we go. So the goal is to get them back to doing
Damn
the
it, I have
things.
to finish my wine to be like fired up, like, ah! Sorry. I get
Okay.
silly sometimes.
So I kind of wanted to just kind of bring that up because I think that that is what kind of makes us different than a PT. You know, yes, a PT will help you with range of motion, you know, getting your strength back and doing all sorts of different, maybe even functional exercises. And they are, it's not to say that PTs don't, you could talk to a PT and they'll say like, yeah, we do functional stuff too, you know? But at the end of the day, we really are, as OTs, the experts on getting people back to doing everyday tasks that we take for granted. And as a hand therapist, that's what her focus is. And that is one of her goals with them is for, even if it's to wipe their ass or to open a water bottle, like that's what we're here to help them do, you know, these sort of things. And we do that through various techniques and, you know, manual mobilizations and even splinting, all that sort of stuff that you guys will be learning while you are in school. But yeah, like don't lose focus of that. At the end of the day, these are people that have everyday things that they want to do and different roles, maybe even as parents. And maybe they just, all they really want is to be able to carry their child without pain, you know, so don't lose sight of that, you know. So I love the fact that, you know, that I feel like hands-on therapy services is not just, okay, let me get physical therapy. Like, no, like, let's get you to doing the things that you need to and want to do.
Yeah, at the end of the day, like the therapy world, we're kind of I always have analogies. I have analogy for days. We're all mechanics. Like we help fix people. Occupational therapists have a different way of fixing people, and we have a different approach to fixing people. And I always like to say that OTs, we all have like a creative bone. Like we tend to be a little bit more creative, but you know, you can pick any field where you can help people, any part of the rehab world, I think. But yeah, like I like that. Hi, Moses. I like that OTs, we just have a different approach about it, and we can be more creative. I think it's a lot of fun. We have a lot of fun, I think. I have a lot of fun. I don't know about anyone else, but I have a lot of fun.
She does. When you see and follow her, like on her Instagram and stuff, you'll see that, you know, they work hard and they play hard here.
People think we just like have fun all day. They're like, I want to work with you. I'm like, you don't even know how hard I ride these people. Like, it's not easy working.
I'm actually kind of glad that
I don't know if you wanted that job. Like, it's fucking hard. Like, people are crying in their cars. Like, oh my God. I can't turn back.
Why did I get it? All right. So we will, like, you know, we've been here for a while. Get the book, guys. So yeah, we gotta get going. Any last minute advice, last words that you want to leave with our OT students in the group, or pre-OTs watching, or congratulations? Like, just good luck.
Good luck. Get into occupational therapy school. Finish it. Try not to have a shitload of loans, and then get a job. And if you, and then if you need any advice,
you got me.
All in between the time, you've got Jess. And you can always follow. If you have an interest in becoming a certified hand therapist, or to work in orthopedics, you can follow CHT Secrets. Right now, I only have Instagram, where I do posts and stories and stuff like that. And you can, of course, sign up for emails from me. And then I also do, I have a YouTube channel. So I do give some career advice on there, very specifically towards therapists that want to get into the realm of orthopedics and hand therapy. But Those are my 2 channels right now for CHT Secrets, and I hope to bring more content out there. So if you want more stuff from me, if you want to email me directly for any questions that you might have as in regards to being a hand therapist or working in orthopedics, then sign up for my emails on CHT Secrets.
You see, I give you guys resources to get where you want to go.
Yes.
The world is your oyster. I'll leave you with that. And have a great night, y'all. Bye.